Good evening, and welcome to this week's edition of Thinking Thursday. And as you see, we will be discussing sickle cell disease. September is Sickle Cell Awareness Month, so we made it in on the last Thursday of the month to talk about something that is very important. We don't even think about sickle cell disease anymore, but it's alive and well, unfortunately, and it affects many people in our community. So tonight we will be joined by Darrellon Prince, and she is going to be our resident expert tonight to let us know what we can do, what's real about this disease, and how it impacts all of us. So I want to introduce Darrellon. Before we get started, just introduce yourself.
Hello, I'm Darrellon Prince, a mom of a sickle cell warrior daughter, and also an author of a couple of sickle cell books, as well as a founder of a sickle cell organization. Thanks for having me.
You're welcome. And we're going to find out more about all of these exciting things you have going on. For those of you, if it's your first time here, we always begin with some deep breathing. Why? Deep breathing does so much for the mind, body, and soul. When you're taking in deep breaths, you're taking in deep cleansing breaths, and we're going to practice in a moment. It adds more oxygen to your brain and more oxygen flowing through your body. And as that happens, it allows you to relax and decompress. Darrellon and I were both joking. We had such a stress-free day, not. And it's just a typical day, not a bad day. It's just so much going on. So this allows you to take a moment to just decompress. It can open your mind and you can listen a little more clearly. And it's something I recommend you doing any given time you think you want to be stressed. So in order to get ready we're going to do a practice breath. Put your hands on your stomach. And as you breathe in, you're going to breathe in so deeply that you will feel your stomach rising because air is going all the way down to the stomach and the bottom of your lungs. So breathe in and breathe out. I'm going to count you in to a count of 4, and I want you to breathe in that deeply and that slowly, and breathe out. Breathe in, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 2, 3, 4. One final in, 2, 3, 4, out, 2, 3, 4. Hopefully that gave you a moment to just decompress a little bit and relax. I do want to say last week we were not on, there was no notice that we had a death in the family. Someone was killed and I needed to leave town to go pick up my son. And you know, I am Superwoman. Sometimes that S is up there and we all know that S is unreal. So I was going to drive to Tyler, get on at 7, pull over at 7 while I was driving back to state, hey, I'm going to upload a show for you to watch. Yeah, that didn't happen. My mind was consumed with everything that was going on, and no, there was no notice, just no show, didn't even post later, this is what's going on. So forgive me for just missing you guys last week, and I'm glad to be back. Well, as I said, tonight we are talking about sickle cell disease. It is Sickle Cell Awareness Month, September is, and we need to figure out why in the world it's worthy of an awareness month, and what is it? Many people don't know. They still don't know. It is a disease that I found out when talking to Darrellon, that it doesn't just impact African Americans. I knew it impacted a few others, but she opened my eyes to that. But it does, we are a large chunk of who it addresses and impacts. So we want to talk about that. So Darrellon, first just educate us. What is sickle cell disease?
Well, sickle cell disease is an inherited blood disorder, meaning that the child gets it from the parent. And it's also the number one, it's the, sorry, I had a brain lapse. It's the most inherited genetic blood disorder in the world, sickle cell disease.
Wow.
And there are various types of sickle cell disease and causes different crises in the patient. And there's no cure for sickle cell disease. There's been some patients that have been cured by genetic therapy, gene therapy, as well as bone marrow transplants. And we know that's very dangerous for the patient, but there have been patients that have been cured that way.
Wow. Let me back up. Okay, you froze for a minute, but you're back. You said there are several kinds of sickle cell. Can you
Yes.
tell us about that?
Mhm.
What do you mean if they're, we think it's sickle cell and that's just it. So tell us, what are the different types?
Well, I'll give you some of the most common. One of the most common is hemoglobin SS, which means that, well, when we say sickle cell, most or blood cells around, when they're sickled, there's a curve like a sickle, the garden tool. So hemoglobin SS, which means the patient has a sickle cell gene from the dad and a sickle cell gene from the mom, and that gives most problems for the patient. There's also sickle cell SC, which is also causes many problems. There's sickle cell S, and it's inherited when one parent gives you an S, and the other parent gives you the C. There's also sickle cell beta thalassemia, and it's the same when you get one S from one parent, and then the beta thalassemia from another parent. So those are some of the most common. There are many different types, but those are where we see most often.
Are the symptoms the same or different with the
They're
different
different.
strands?
They're different. And there's also sickle cell trait. And there's a misconception that sickle cell trait doesn't give you any problems, but it does. I have sickle cell trait, and I've had issues, crises, if you will. And sickle cell disease affects people differently, just as diabetes may affect patients differently, or lupus may affect patients differently. Some may go through life with very few crises, where others you may see in and out of the hospital quite often for pain crises, for what's called acute chest, for needing blood transfusions, and several other things.
So when you say crises, and you hear that term when you talk about sickle cell, a person is in crises, and you just kind of alluded to the different types. So what is a sickle cell crisis?
Okay. Well, the pain crisis is one of the most sickle cell patients experience a pain crisis, and it's not stub your toe or hit your knee type pain crisis. Actually, one young lady on TikTok has put out a challenge for sickle cell disease pain, and it's called the Sickle Cell Lego Challenge. And the young lady says that sickle cell pain to her feels like walking on Legos continuously. The pain doesn't go away. So for sickle cell patients that experience the pain often, a pain level 10 to them may actually feel like a pain level 5 to them, whereas to us, it would probably feel like a 12 or a 15, but they experience pain quite often. There's also sickle cell, there's also acute chest, which is life-threatening. Patients also experience strokes.
As a result of the sickle cell, they experience strokes?
Yes, my daughter's actually had several strokes. She's had a hemorrhagic stroke as well as ischemic and several transischemic attacks. Also, you have I'm sorry, there are issues where men, the males, they experience with their private area. It's very painful there for them as well. So there are several crises that the patients go through. I mentioned blood transfusions. Lots of them have regular blood transfusions to try to cut down on some of the crises. There are patients that have had their hip replacements, other organs that are not working properly, pneumonia. So it's not just a disease that doesn't have any problems. And there are some patients as young as infants that die from it. And then there are some that actually live until into their 70s and 80s.
So I know in the past, the life expectancy was pretty short, but it looks like it's increased. Is that pretty common that the life expectancy has gone up? What would be
Yes.
the average age?
Well, in the 70s, I believe the life expectancy was 20, and it's gone up to 50. There are new medications that are finally coming out to help sickle cell patients, which is wonderful, which helps with the life expectancy. And there's a guide when you're followed by your hematologist to help you maintain your sickle cell disease.
I want to go back to something you said earlier. You talked about the sickle cell trait. Could you explain what that is? What is the difference between the trait and the disease?
So when sickle cell disease, the cells mutated, if you will, many years ago, the cells mutated because of malaria. And folks with sickle cell trait were not, did not become gravely ill from malaria. And then the folks with the trait married and they had children with sickle cell disease. And unfortunately, those children became very ill from malaria. Well, moving forward to today, some patients with sickle cell trait, they experience altitude sickness, and that's low and high altitude for me. I went to the caves in San Antonio and I had to be emergency evacuated because I couldn't breathe. Excuse me. And also I know you may have heard of some athletes out in the community that have suddenly died because they had sickle cell trait because they've overexerted themselves. And one way it was explained to me by a doctor is that sickle cell patients, their bodies used to going through these crises. But when you have someone with the sickle cell trait, they're not used to this crisis, if you will, sometimes. And they're overexerted, they overheat, they have this major crisis, and unfortunately, they pass away from that. So there is an organization that teaches you about sickle cell trait and the importance of maintaining yourself so you stay healthy. Mm-hmm.
What are some of the challenges you have faced as a parent with a child with sickle cell? What is that like? Share with us, make it real for my audience. What is that? What has life been like?
Well, since my daughter's strokes, she's on what's called chronic paresis, and every 4 weeks or so, she goes into the hospital and she gets what's called an exchange transfer. She's hooked up to like the dialysis machine and they take all the bad blood out and give her new blood. Right now, she receives 10 units of blood. We have to plan our life around there. So if we want to go on vacation, we have to count. Is this during the time that you're going to get your apheresis or not? During the shutdown of the pandemic, unfortunately, a lot of people weren't donating blood.
Right.
So she was not able to receive the 10 units that she usually receives. And that was very alarming to me, because if she doesn't receive this blood, is she going to go into a crisis? But thankfully, she wasn't able to go into a crisis. Also, now that she's an adult, a lot of horror stories I hear about adult patients going into the hospital, uh, into the emergency room, seeking pain medication, are turned away or frowned on or not believed, because some hospitals, not all, but some hospitals believe that sickle cell patients are drug seekers, which isn't true, because a patient can look normal and maybe not have the face of a pain level 10 when they're going into the hospital. But the doctor, because they're so used to these patients coming in asking for these narcotics, they don't want to give it to the sickle cell patient, or they'll give them 10, maybe even 6, which is not going to carry them through to get their crisis taken care of. So that's scary to me, because I want to make sure that my daughter is taken care of. She's comfortable and she's pain free. There is a clinic here in Houston. It's the University, it's UT Sickle Cell Comprehensive Center, and they're really great. They offer an infusion room for patients, for adult patients. Well, I think, I'm not sure if they offer children as well, but for adult patients, you can go in and you can get IV treatment, and you can have your pain medicine there. They only offer Toradol there, but if you have pain medicine, you can bring it for yourself. And Hannah was there last week when she had a crisis, and they took care of her, no problem, no questions. And she was in and out of there in about 5 hours, which was great. Mm-hmm.
How long does a crisis typically last?
Some crises, they can last for hours. Others can unfortunately last for weeks or more.
So that's weeks being with your pain at a 15.
Yes.
And one of the things we often hear about is, for African Americans, it's believed that our pain level is different. We don't perceive pain the same way. So I can see that making it even more difficult to get assistance with the pain. That
Yes.
misperception in the medical field.
Mhm.
You talked about blood transfusions, and I think you have an organization that does a blood drive. Tell us about that.
Yes, in partnership with our church, the Pincushion Gang, we've actually had a quarterly blood drive every year since 2007 at my church. And we've been pretty successful. We've had a few that weren't, we didn't reach our quota, but most of them we reached our quota. And with each blood donation, you save actually 3 lives. So that's really good. And it's very important for African Americans to receive blood from an African American because of the antibodies. We can receive blood from anyone, but it's much better for us to receive blood from African Americans.
What else can you say? Look into the camera and say something to implore people to become a donor. When is your next blood drive? Or have you had your last one?
The next blood drive is, I believe, the second Sunday in December.
Okay, and we will remind our audience at that time. So what can you say to someone who is maybe reluctant to be a blood donor? What can implore them?
Well, get educated first on where your blood is going, because I'm sure you want to know what's being done with it. But it does save lives. My daughter, as I said, receives 10 units each month. And if it were not for those units, she may have strokes or other crises, not only her, but other sickle cell patients. If you're afraid of the needle, there's someone there to hold your hand. If you're anemic, then we have information on how you can bring your blood up. But it doesn't take a lot of time, and it's very important. And you go away knowing that you've saved lives.
outside of your quarterly blood drives, if someone wanted to specifically say, I'm donating blood for sickle cell patients, is that something they can do?
Yes, well, we have a code actually that we donate through the church. So it goes towards that account, if you will. And that code is R like Robert 577. That's R like Robert 577.
So when you want to donate blood, you just give them that code and it specifically goes toward sickle cell patients.
Well, not specifically towards sickle cell patients, but it will go towards the bank, and the bank knows that you're trying to build up the blood bank for those patients that are in need.
Okay. So it's still a way without being at that quarterly drive. Now, where will this drive be? I know it's not until December, but where will it be located?
It's going to be at the church at Bethel's Family, and that's at 12660 Sandpiper Drive in Houston, Texas. The zip is 77035, I believe.
And I will put that in the chat later on or post it with this episode so that people can be aware. And if you remind me the week before, I will, no matter what the topic is, I'll make sure I put it out there to remind people about the donation, because it is very important. And again, it's something we don't think about doing. I don't want to donate blood. It's going to hurt. It's going to do this. What are they going to do with my blood? You know, people have so many things, but I can say this: donating blood truly can save lives. We're talking about sickle cell, but it can save lives of so many people with whatever diseases they may have, whatever's going on. It is a very beneficial thing. And you're right, some of the just different antibodies that we're going to get can be very beneficial. And we need to do it. The life you save may be your own. The life you save may be a loved one because you decided to donate blood. Does the Pincushion or the Pincushion gang do anything else, or is that just the main focus?
No, we also, well, when they're available, we also attend health fairs. The main focus is the patient, to let the patient know that someone's there, there's a voice, we care for you. And we try to do events throughout the year for children, especially because there are other organizations and the children for other diseases, and the children see that these organizations are doing things for their kids. And so I try to do things for the sickle cell patients as well. Last year, before the shutdown, we were able to send, I believe, 6 families to the rodeo. So that was good. And there was another rodeo event before the shutdown that we were able to send patients to. This year, we've had several events, but most of them, we had to drop items off at Texas Children, and they hold it for 3 days to quarantine, and then they hand it out to children. So we haven't actually had any hands-on things, but we have had events where the children were able to be blessed with items.
Do you guys have a website?
Yes, we do. It's the pincushion.gang.org.
And I'm going to put that in. The reason I'm asking, if someone wanted to donate, could they? Can they go to your website? And
they sure can.
And that's the pincushion.gang.org.
Yes.
And the reason I'm asking, that is something worthy, and people may want to donate to that. I see we have someone who says, they know a few individuals suffering from sickle cell, and someone asks, can you get sickle cell if either of your parents don't have the trait? What causes a person to become impacted with sickle cell?
Right, so the parent has to have the trait or sickle cell disease. So both parents with the trait will give the child the trait, and they'll have sickle cell disease, or one parent will have sickle cell disease and the child would get an S from that parent because that parent has both two S's, and then they would get an S trait from the other parent. But yes, the parent has to have the trait or the disease in order to have sickle cell disease.
If one parent has a trait and the other does not, could the child still get the disease?
No, then the child just has a chance of getting the trait only.
Right. Okay. And these are things, you know, we don't know. We want to put it out there so people really understand. You know, we hear that it is Sickle Cell Awareness Month, and a lot of people didn't even know. How long has Sickle Cell Awareness Month been around? When was it initiated?
Well, back in 1983, President Ronald Reagan signed a proclamation making September Sickle Cell Awareness Month.
And a lot of us didn't know about that.
Mhm.
What about, you know, on this show, we look at the mental health, and let me back up in case there's some who've never been before. It is the understanding of this show that mental health, physical health are just part of your health. They're not really separate. It's just a different part of your health.
Mhm.
By that, I mean, if you are physically ill, it will impact your mental health. If you're mentally ill, it can impact your physical health. For example, a person who may have a chronic illness can deal with anxiety and depression based on, I'm tired of being sick. A person who may have anxiety and depression may become physically ill because they stop taking care of themselves properly, and because of that mental state they're in, or a person with chronic mental illness such as schizophrenia. These are just some examples. You stop taking care of yourself and you develop health problems because, you know, so it's all related. It is our health. And when we look at one part of our health, we have to look at the other because they all interact. Are there any mental health challenges such as depression or anxiety that people with sickle cell may deal with?
Oh, yes, both. Depression because they have to deal with this disease, and a lot of patients are silent sufferers, unfortunately, because they don't want to be stigmatized. They don't want people to feel sorry for them. They don't know because it's not so well received in the community. They don't know how to approach people with it, so they deal with their disease silently, and the anxiety of knowing or of planning something. My daughter, when she was young, she um, went to ballet school for 9 months. And on the night of her recital, she went into the hospital for 2 weeks. She missed it. So, and and that's how it is. You go through school, and on the day of the graduation, you're like, oh my gosh, I'm having a crisis. I missed my graduation, or other events, family events, just going to the movies. You want to plan to go to the movies, and then here comes a crisis, and you can't go because you're in pain.
Does stress play any role in developing a crisis?
Yes, yes. hmm
And
Daily stress
mhm. So
can put
even the
people.
stress of a positive event, such as your dance recital, because there's just that normal excited stress, you know.
Mhm.
They call it eustress. It's not the negative stress, but it is a stress in our body. It has that same physiological response. And a lot of times people with various physical illness, the stress, the eustress, the positive stress can still have a negative impact because your body is receiving the stress signal. So I could see that. How are how is it finding mental health help with this disease? You know, you're stating that anxiety, depression are they're real, they're there. How
Mhm.
easy or difficult is it to find mental health help?
It's not that difficult. There are actually counselors, therapists, psychologists, psychiatrists that specialize with patients in with chronic illnesses, so they know how to um, care for them.
And that's
Mhm.
good because that is well needed. And it is definitely an area that you would want someone specializing in. What about, we've talked about medication. Are there some alternative forms that you may have used with your daughter? Alternative medications?
Yes, I try to, because I try not to stay with the morphines and the Norcos and tramadols, Toradols. I think that's what they call them. But we found that turmeric, as well as this medication called Even Flow, which is all natural. We use that to try to help with pain. But we put there's turmeric pills, and then there's turmeric powder that you can put on your food. So we try to put that on every meal, cook with that every day to help. But we also use distraction, um, heating pads,
What do you
hot
mean by
baths.
distraction?
Um, our favorite movie, um, go from outside, sit in the backyard, read a book if you can, but something to try to get your mind off of it. Listen to your favorite song, those type things.
Mhm. And that is good to know that there are things you can do that help in the meantime or can maybe stave off something, because we look at, I am not anti-medicine, but we have, when you take medication, so often you have other side effects, and
Mhm.
you look at the side effect and think, oh man, I got to do that. And then, so you take another pill to counteract the side effect, but the pill you take to counteract that side effect has a side effect too. And so
Right.
sometimes we can get in that loop. So it is good to see that there's some other things that we can do. You mentioned something to me that I was unaware of, honestly, and that was that sickle cell disease is not just an African American disease. Tell me about that. That blew me away.
No, it's not actually. About, I'm not sure, maybe about 10 years ago, the poster child for the National Sickle Cell Association was blonde and blonde hair, blue eyes. But the sickle cell disease, it's found in Italy, Italians, Greek, um, Afghanistan, the sub-Saharan area, um, and with all of the interracial marriages, it's found in every nationality. I mean, Puerto Ricans, Mexico. Yes, it's not just a Black disease. You can find it in every race.
However, are we still the predominant culture that is experiencing that sickle
We
cell?
are. We are. Yes.
You talked about the stigma. Tell me about that. What stigma is, and with any disease, there's a stigma. What are some of the stigmas that people are dealing with?
Well, one, because the sickle cell patient, they could, for instance, a child could be outside playing, having a great time, enjoying themselves, and come in the house, and not even 10 minutes later, they're in a terrible pain crisis. They're doubled over crying. And just think if that's an adult and they're at work, and then suddenly they're not feeling well, and they're like, you were just fine a minute ago, laughing, playing, and talking. And because it's not so, I don't want to say advertised, because not too many people know about sickle cell disease. When someone tells you they have sickle cell disease, there's always a question like, well, what is that really? Are you sure you're in pain? Are you sure you're having a crisis? So that's why we have to get the awareness out on sickle cell disease.
And that really was what I wanted to do tonight, was to put it out there. People don't know. So like you say, when you hear it, you know it's real, and people may have heard of it and they know it's a real thing, but what is that thing? There is that lack of understanding, and that is really what I wanted to put out there. What other things would you like us to know about sickle cell disease? Now, we used to hear, let me ask you this first. I used to hear the term sickle cell anemia, and now I just see in the literature sickle cell disease. Why did the name change, or what's that about?
I think it was always sickle cell disease, but you really concentrated on the anemia part of it.
Why is
Mhm.
that?
And that I'm not sure.
Okay. And now you just see it more, termed that way. And I know terms, change over time, but we know sickle cell. When you see that, whether it's anemia, whether it's disease, we know that it's an issue that we
Mhm.
need to address. So, what would you like to say? What are the things would you like to know to sensitize people to the disease and to people who are managing and living with this disease?
For the people that are not aware, ask questions. It's okay to ask questions. Do some research. St. Jude's, they have a really great program, and so does St. Louis Sickle Cell Organization. And for the sickle cell parents, listen to your children. Sickle cell adult patients, listen to your body. Make sure you see your doctor regularly, take your medication, stay hydrated, do your proper maintenance. And you all are important. You're important to me, and you're important to the community. So take care of yourselves and ask for help when needed.
And that is so important in all things. Ask for help when needed. And then we have to be sensitive, those of us who don't have the disease, we have to be sensitive to know that these people are in need of help. And like I said today, that is the whole point, to put it out there that this is real. It's not going anywhere. And as you said in the beginning, there is no cure. There's bone marrow transplants, there's gene therapy, but it's not a cure yet. So it's something we have to be, ever vigilant and know that it does impact our community greatly. Anyone can get it, but it's more of us as African Americans than any other specific ethnic group. So thank you for sharing that. Before we wind down, I wanted to mention an event that is going to happen this Saturday. Um, my sister and I started doing prayer vigils quarterly. The prayer vigils have been going on for years. We would do them, every so often. But year before last, in 2020, in January, right before COVID hit, things were crazy in the world. We were on a conversation and we jokingly said, we need to have a do-over. We need to pray the new year in at the end of January, because January 2020 was horrific. Well, that was before COVID hit, and the year just sort of went downhill after that. And as the year ended, we decided for the year of 2021, we'd have quarterly prayer vigils, looking at everything that's going on in the world. And the one this month is this Saturday. And if Sister Mama Sonia is online, she can type in the information. If not, I will post it. But it's a 12-hour prayer vigil. We call it 12 for 12. We start at noon and we pray till midnight. We have a list of things we're praying for, such as violence in our community, the health, mental and physical health in our community, education, CPS, um, the cradle to prison pipeline that goes through CPS and our education system, family, church leaders. These are some of the things. Each hour has a focus. I will post on this page what the different hours are, and you can just join in and be there for that hour. Some people come in and stay 12 hours. Some come in for an hour, some see, I want to go and pray for that. So feel free to join us. I will, like I say, I will definitely put it out there. It's something that we do to, that's our part of what we do just to make the world a better place. Praying for it. As we wind down, those of you who know, I like to do a call to action every week. This week's call to action is this. Be aware of the things that impact our community health-wise. Sickle cell is one of them. Take time out. Tonight was a teaser. Take time out and find out some more information. Know your status because Darrellon can tell you, you may have the trait and may not know it. Some people can be adults and it's never been found out. And so you might want to know that. If someone, as she said, if someone has sickle cell, be supportive. Know that this is something impacting them and it is real. So once you find someone that you know, we had someone on Connector earlier who said she knows people who are suffering from sickle cell. If you know someone, get educated, know what it's about. Know other illnesses and just be aware of what people are going through and be that supportive person. And as always, I say, be an educated voter. There are laws that can impact our health when you want to deny money for things or want to put money in certain areas. They can be voted on. So be an educated voter. And I still say, mask up. COVID's not gone. Be COVID aware, be COVID careful when you go out. Thanks for joining us. And Darrellon, thanks again for being here with us. As we end, I will look forward to seeing you all on next Thursday as you join us once again. Any final words you'd like to say, Darrellon?
Thanks for having me and thanks for bringing awareness to sickle cell disease. I appreciate it.
You are more than welcome. Thanks.
Thanks for having me and thanks for bringing awareness to sickle cell disease. I appreciate it.
Bye-bye. You are more